I'm Andrew Schumacher. Today we're going to be doing a chest tube insertion. So in order to start out, we want to make sure we have all the proper materials. We have our chest tube. We have our scalpel, which doesn't have a blade on it yet. And we have...
Did you open the kit unsterilely and now handle it?
We're just checking right now for the different materials. And these are our two instruments that we're going to be using, one to dissect as we get into the pleural cavity, towards the pleural cavity, and one to actually puncture through the pleural cavity and insert the chest tube. So we're using sterile technique today, so the first thing we're going to do is sterilize the patient. Once we sterilize the patient and properly drape the patient, we'll be taking our anesthesia, or lidocaine, and inserting in three major places. One is going to be around the skin. One is going to be around the periosteum, around the rib, another very sensitive area. And the third is going to be right around the pleura itself. Make sure we get extra doses in these three areas because those are the sensitive areas. So we have our patient draped and prepped. We're going to palpate for somewhere either the fourth, fifth, or sixth intercostal space. So we start out by palpating the sternal notch. This will indicate where the second rib is. We go laterally. I'm going to choose the fifth rib. And we want to go just anterior to the mid-axillary line. This is our scalpel. Make sure we get a fresh blade. Go back to make sure that we palpate the fifth intercostal space. Stand to the mid-axillary line. We've inserted our anesthesia. Cutting through about a centimeter or 7.5 centimeters wide. We go just over one rib, underneath the other rib, dissecting along until we meet resistance. Let's take our larger instrument. Until we feel a puncture. And we palpate with our finger. Make sure that we can feel the lung. We're going to insert the chest tube. So our technique is going to be over the rib, and then we're going to guide it either posteriorly for a fluid collection or anteriorly for an air collection. We want to insert up to about 2 to 4. Once the tube is in place, we want to make sure that we've secured it to our vacuum device, and then we're going to stitch it in place. We can use a U-stitch so that when you take the chest tube out, it can be more easily secured in place, and you can avoid getting air back into the pleural space. So that's the insertion of our chest tube.